Hey everyone, Dr. Charlie Johnson here, and for those of you who don't know me, I'm a physical therapist who specializes in helping people heal non-surgically, so naturally, without things like pills, injections, and or surgery. So before I get started, if that's you and you're looking for an alternative solution to feel better and get back to the life that you want to live, then just call 484-552-3767. So with that being said, in today's video, I want to sort of clear up the mass confusion and chaos, as I had in the remarks there above in the post title, because a lot of people in pain are just that. They're just confused and they're lost, and it's no wonder why. So if you're in pain, you're looking for an alternative, healthy solution to get back to normal, you've likely tried many things, right? There's a lot of options. So you've talked to your friends, you've talked to your grandma or your sister, your brother, you've Googled things, you've gone to the chiropractor, or you've asked the question, hey, will acupuncture work for me? You probably saw your primary care physician first. So here's the normal path, right? And then we'll talk about why you can be confused and how you can gain clarity in trying to find the solution that is best for you. So here we go. So most people, let's just say like a map, you are here. Right? You go to the mall, you go to the outlets, you go wherever, and you look for that map, right? So we're staring at it right now, all right? So you are here, right? And what happens is people are in pain, right? So something happens, right? Or has been happening for a while, and you decide, hey, I'm going to do something about this, right? And what you do is you go to the primary care physician. So we'll say PCP or your family doc, whoever that is, right? And that family doc says, hey, things don't look too good, right? But you're going to need pills, or maybe we'll send you to the specialist, an orthopedic physician, if it's, say, a back problem, a neck problem, knee problem, shoulder problem, whatever it is, to get x-rays. So they're going to tell you to go see the surgeon, right? And then the surgeon's going to say, hey, it doesn't look good. You've got the back of an 80-year-old, and by the way, here are your images, right? And then they're going to either refer you maybe to PT, or they're going to say, hey, we need an injection. Right, so you get an injection, and then you're going to need surgery, right, and so on and so forth. So now, with that being said, that's the traditional path that people have been trained for years to follow. The problem is that it doesn't work, all right? So we have the most advanced imaging in the world. We have some of the best surgeons and surgical techniques and things like that, yet we have the highest incidence of pain. We have the best medications, yet people are taking them and overdosing all over the world, and we still have the highest incidence of pain. So clearly what we're doing to manage these problems isn't working. So I challenge you to think of it differently. So here we go. This is the old school way of thinking, right? And yeah, maybe you go to PT somewhere throughout here. I'm a little biased, but we'll talk about where that bias comes from, and why I think PT is the best entry point for you if you're in pain, all right? So now let's step back. So basically what happened is you saw that you just went to multiple different providers, and you got different recommendations and opinions throughout that pathway, right? So what you have to understand is that everybody that you go to see for your problem is wearing their own pair of goggles, right? And what I mean by that, you have to be really aware of this, all right? So it makes a lot of sense to people on the back end whenever I end up working with them, but on the front end, they're just blinded by the fact that they're in pain and they want relief and they're willing to do whatever it takes, right? So people go from this stage of, hey, I'm just going to ignore this, right? So doing really nothing about it, maybe dabbling in a few things here or there, and then they say, hey, I'll try to maybe cover this up. I'll take some pills, some Advil, put some BioFreeze on it, something like that, right? And then they say, screw it, I'm all in, I'm tired of dealing with this, let's do everything. And then they start down what I call the healthcare rabbit hole, and it's this idea of going to the primary care physician, not getting the answers you're looking for, or hearing something that scares the heck out of you, and then it leads you to the next thing, which is often the surgeon, which leads you to the next thing, which is multiple rounds of imaging or failed injections, pills, things like this, and you just get further and further down the rabbit hole. So when I was younger, it sort of reminds me of this analogy. There was like a couch in the corner. There were two couches butted up, and there was a plant in the corner of a room. And what happened is I had fallen head first into this hole. I remember just freaking out, quite traumatic. My legs were flapping all over the place, and I was just sort of trapped, right? So a lot of people feel that, all right? And here's how through this understanding and knowing that who you go to see is going to have their own opinion, right? You can get out of it. So, right, so you've probably been through this experience, as we've already chatted about. The primary care physician has been trained to do things a certain way, right? And see things in their own light. So they're going to say, hey, there's something wrong with you, you need an x-ray, whatever. There's maybe an inflammatory problem, all right? And therefore, right, get this also. Not only are people trained to see things in their own way, and therefore, depending on who you go to see is going to determine what you get, but it's also, or what you're told is wrong with you, right? So a diagnosis that you're told, but it's also going to determine what you get, or the treatment that you receive. So, right, you've got all these people. This is a people, right? This is your diagnosis. That says diagnosis. And then this is your treatment, how they treat you, right? So the primary care physician has been trained to see things, maybe aches or pains or whatever. Oh, this is an inflammation problem, right? You hurt something, right? Generally, it's not much better than that. So that's your diagnosis, something hurts. The treatment is you're going to rest. You're going to take these pills, anti-inflammatories, naproxen, Advil, muscle relaxants, right? Or maybe they just say, hey man, you just got arthritis, you just gotta live with it, right? You go to the surgeon, right? Something's broken, right? A structural problem that therefore they can go in and fix, right? So they're going to fix it. And how are they gonna fix it? Surgery, right? Injection, pill, whatever. You go to see the chiropractor, right? Generally traditional chiropractic, right? You might be out of alignment, right? You've got subluxation, something like that, right? And therefore, don't be surprised if you're told that you need to be put back in alignment. How? Adjustments, right? Again, not every chiro, but this is just kind of the general idea here, right? You go to try yoga. You're still like, hey, I just want to do this myself. I don't like doctors, right? You go to yoga, and what do? They say, you're just so stiff. Or you need to be stretched out, right? So if you're stiff, something doesn't move well, we want to give you stretches, and the answer is yoga. Crazy, right? Massage. You've got knots everywhere. You're so tight, right? Let's release those. What do? You get deep tissue, right? PT, your core is weak, you've got a core problem, and therefore we need to increase your core strength. So it sounds like, when I lay that out, you're probably like, yeah, that makes so much sense. But if you've been in pain and you've gone down this healthcare rabbit hole, you've seen different people, right? You're probably like, oh my gosh, why didn't I see that, right? Why couldn't I, of course if I go to see a surgeon, they're going to tell me I probably need injections or surgery. Of course if I go to see the massage therapist, they're going to say, hey, I can help you, you just need deep tissue work, right? And this is just absolute madness, right? Just chaos. It's going to lead you to confusion. You're going to think you're just screwed because you've got all this stuff wrong with you. And because you've tried all these things, you're going to think that nothing works, all right? So this just leads to craziness, all right? So now imagine you had one person, right, who could step back, right, kind of had the idea and who has worked with all of these people, right, and could see, right, what was best for you and your specific needs, all right? So with that being said, this is everyone wearing their goggles, right? You really need to have somebody step back, right, and approach this systematically. So the next problem that people have is after they've done all these different things, right, they resort to having done this. So this is a ball of energy, right? And let's just say you've got 5 rays, right? Here's another ball of energy. We'll get to that in a second, right? This is what doing everything in that whole goggles example looks like, right? A lot of confusion. What I mean by that is that, let's just say each of these rays goes 1 inch in each direction, right? This is what most people, when they're trying to solve their ache or pain, do. So they go to PT, right? They're told X, Y, and Z, right? Oh, and then the PT does a whole sheet of exercises with them and can't figure out why they don't understand what's working and what's not working, right? They go to the chiro, and they get adjustments, right? All kinds of adjustments. You get your neck cracked, your back cracked, your leg cracked, right? All of this, right? Then you go to massage, you go to yoga, you take some pills, right? And the point is that you're a plane here, and you're trying to get to a destination, and you can't because you're going 5 different directions, all right? So it just leads to madness, and you really don't get anywhere far, right? So what you need to find is you need to find somebody who can step back, see the big picture, right? And then through treating you, do only the best 1 or 2 things such that you can determine what's best for you, right? So if you do, so my wife, she makes a lot of good food, right? But she just kind of like, hopefully she's not watching this, but she just kind of like throws a bunch of things in there. Well, it's kind of funny because when she bakes cookies, it has to be exact, right? So you can replicate it over and over again. But anything besides baking, she'll just throw all kinds of seasonings and spices. And it's like, hey, honey, that's great, but what actually made it taste good? Because then the next time you taste it, maybe it doesn't taste as good, right? So the point is that really when you're working with someone, right, it all needs to operate off this thought of like, hey, what's going on, right? What's the question here? What are we thinking, right? And then we want to pick only the 1 or 2 things, right? Such that then you can go do the work. Here you are doing the work. And then from that, right, you're going to get a result. You're either going to stay the same, you're going to get better, and you're going to get worse. Or you're going to get worse, right? And then based on that, we can go back and we can say, hey, did we have the right thought? Did we have the right treatment approach? And this is then a nice process of discovery such that you can actually know what's working, right? So what happens is some people go through that process and they say, hey, chiropractic worked great for me. Hey, massage worked great for me, all right? And really what you're playing a game of is like this whole Russian roulette idea. So my daughter, she has this, little thing of blocks. She's 2 years old, right? And it's got a square, I think it's got a triangle, it's got a circle, and then I think it's got something more complicated, a star, right? Now, 1 out of 4 times, or I don't know, I'm bad at math, whatever, every once in a while she's going to get one of these right, just by chance, right? So there's a chance there that you could randomly pick one of those things and it could make you better, right? So she's going to just pick up a square and just screw around with it, and one of these times it's going to fall in, right? So a lot of people make the mistake in that when they go to see a chiro and massage therapist or PT, right, they just so happen, 1 out of however many people there were, chances that it worked for them. The problem is that then a lot of those treatments, notice that they're people doing things to you, right? So the massage therapist is putting their hands on you, massaging you. The chiropractor is kind of doing maybe a similar thing. The acupuncturist is doing needles or whatever it may be. The surgeon is maybe going and doing surgery, giving you a shot, right? But at the end of the day, you don't have any control over that variable. You don't have any control to, on your own, experiment with picking up the blocks, right, and trying to fit them in the appropriate hole. So you're not going to learn because it's once and done. You go, you feel better, okay, somebody told me the answer, and then you go home and you're like, why can't I figure this out, right? So if you have kids or whatever, just think of it this way. If you want to learn how to do math, you have to do the math, right? You can't have the teacher come in and tell you, hey, this is the answer. Just here's how you add things up. Here's how you solve the equation, right? Because then when you go home to do the homework or when you get the test, you're screwed, right? You don't know the answers because you didn't actually put in the work and go through the process of discovery, and you didn't actually learn what worked and what didn't work through that process, all right? Of messing up, getting things right, getting things wrong, and then rechecking your work and whatnot, right? So the same thing happens. Here's a triangle, call it chiro. Here's a square, call it massage. Here's a little star, called PT. And every once in a while, right, if the massage therapist does something to you or the chiro or the PT, right, when you go to their office, boom, they're going to put the star in whatever star or whatever spot it needs to be such that it fits, right? And while that's okay maybe in the short term, this is why these types of approaches that don't teach you what to do on your own and aren't systematic about doing only a couple things such that you learn what makes you better, what makes you the same, what makes you worse, right? This is why they result in only short-lasting relief, all right? So I think that's it. I'll cut it off there. We'll continue at this, right, to clear up any clarity, reduce the confusion, and to stop the chaos. So if you're in pain, you need help, Dr. Charlie Johnson here, 484-552-3767. We'd love to help you out. Comment below if you need help, and we'll go from there, okay? So do less. Less is more. Focus your energy. Realize that everyone you go to see, right, has been trained to see things a certain way, and let's start to bring some clarity to the situation. So thanks so much. Chat soon.